Namaste. Our topic for today is presbyopia. Now, to understand this condition, we will look at two more concepts, that is near response triad and accommodation. So, presbyopia is eyesight of the old age. According to Khurana, it is not even a refractive error. It is a physiological insufficiency of accommodation, which leads to progressive fall in near vision. Let's see the response triad. Near response triad has three things. The first is accommodation, which is affected in presbyopia. The second is convergence of the eyes. And third is constriction of the pupil. So these three things happen together for us to look at a near object. Moving to accommodation. While we are moving distant objects, this is the eye. This is the iris, the ciliary body with ciliary muscles, the zonules, and the lens. While looking at near objects, the ciliary muscle will contract, the zonules will become lax, the tension reduces, and the lens will become more convex or thick. You can remember this like the zonules and the lens act as one unit. Both of them relax while the ciliary muscle contracts. Going back to presbyopia, the cause is decrease in the accommodative power of crystalline lens with increasing age. In accommodation, what we have seen is that the lens and ciliary muscles are performing a great function. So these two will be affected. What will happen to lens is that there will be reduced elasticity of the lens capsule and there will be progressive increase in size and hardness. That is, sclerosis can take place of the lens substance. Both of this make the lens less moldable. And then ciliary muscles will also see an age-related decline in ciliary muscle power. So the power reduces. Next, we go to the symptoms group. The first symptom is difficulty in near vision. The patients are going to complain with having difficulty in reading near objects such as newspaper, and then they'll also have difficulty in doing near work such as putting a thread in the needle. Earlier the symptoms will be first in the evening and in dim light. Later they will be even seen in good illumination. So difficulty in near vision. The second group of symptoms is asthenopic symptoms. These occur due to fatigued ciliary muscles. We can have symptoms like sore, dry, burning eyes, blurred vision, frontal headaches, and light sensitivity. The third group is intermittent diplopia. Now, this diplopia is occurring due to disturbed relationship between accommodation and convergence. The treatment can be optical or surgical. We'll first look at the optical treatment. We give convex glasses to these patients. Now, normally for an emmetropic eye, we have a rough guide. Let's look at that rough guide. If the age is 45 years, the power required to correct is +1 to +1.25 diopters. This is the only value which we have to remember. After that, we have to keep adding 5 years, that is 50, then 55 and 60. And here we have to keep adding 0.5 diopters. So 1 plus 0.5 is 1.5 and 1.25 plus 0.5 is 1.75. Similarly, plus 2 to plus 2.25 diopters and plus 2.5 to plus 3 diopters. This is a rough guide and we have to estimate the exact presbyopic addition for both of the eyes individually. Next, we have to look at some basic principles for presbyopic correction. We will look at it stepwise. First of all, we have to find the refractive error and then we have to correct it. Then we have to look at the presbyopic correction in each eye and then add it to the refractive error. The third is near point should be fixed by taking due consideration for profession of the patient. So we have to look at the profession as to how much near work is he doing. Then we provide the weakest convex lens with which he is able to see comfortably. Presbyopic spectacles can be unifocal, bifocal, or trifocal as per the refractive index of the patient. Next, the surgical treatment. We have LASIK and refractive lens exchange. Let's summarize presbyopia again. Presbyopia is a physiological insufficiency of accommodation which leads to progressive fall in the near vision. The cause was affecting the lens and the ciliary muscles. After that, we have looked at the symptoms. We had three groups of symptoms. First was difficulty in near vision, second was asthenopic, and third was intermittent diplopia. After looking at the causes and symptoms, we looked at the treatment. The treatment was optical and surgical. That's all for presbyopia, and I'll be covering more diffractive errors in the next videos. Thank you.